Hi friends, this is Dr. Kaustav Basu, consultant Gynae Oncologist and Robotic Surgeon with Narayana Health. On occasion of International Women's Day, I would like to congratulate all our women cancer survivors because they had faced a lot of odds in the society, in their family, and they have fought the cancer and they have won a deadly disease called cancer. So today I would like to discuss about gynecological cancers, and I'd like to discuss some measures so that all of you can be aware of how to prevent yourself from having such a cancer. So gynecological cancers include ovarian cancer, uterine cancer, which can be a uterine muscle cancer or a endometrial cancer, a cervical cancer, vaginal and vulval cancers, and associated pelvic tumors. So the most common cancer amongst all of them is cervical cancer. It is the cancer of the mouth of the cervix. A simple test can be done in OPD called pap smear, which can prevent you to develop cancer. Basically, this cervical cancer is caused by human papillomavirus infection, and if you can practice clean menstrual hygiene, clean sexual habits, you can prevent yourself from developing cervical cancer. Second is ovarian cancer. You know, ovarian cancer is a cancer of the 5th or the 6th decade, or the 50s or the 60s. It's very difficult to identify ovarian cancer beforehand. So patients who are at high risk for developing ovarian cancer, like who have family history of breast and ovarian cancer in their relatives, first degree or second degree relatives, they have a more propensity to develop ovarian cancer. Those patients should be regularly screened with a ultrasonography and a CA-125 blood test after the 40s or the 50s. After they have achieved that age, they can undergo regular screening. That will help to identify ovarian cancer at a very early stage. Third is endometrial cancer. So we have seen the patients of endometrial cancer are generally obese patients who have high BMI, and they have that typical metabolic syndrome, obesity, hypertension, diabetes. So if you can prevent yourself from excessive weight loss by doing physical exercises, regular physical exercises, and can have a check on your weight gain, so you can prevent yourself from endometrial cancer. This is because that excess fat in our body will cause more, will develop more estrogen, will cause more estrogen secretion in the body, and this endometrial cancer is a cancer of hyperestrogenic state. So more estrogen content in the body, more will be the endometrial cancer. So if you can prevent yourself from if you can prevent yourself to develop obesity, you can check yourself from developing endometrial cancer. And other cancers are vulval cancer and vaginal cancer. They are also HPV related cancer associated with the human papillomavirus infection, against which are associated with unsafe sexual practices. So if you use barrier contraceptives and clean your private parts regularly, you can prevent yourself from developing this kind of cancer. So overall, please stay healthy, prevent yourself from these deadly cancers, and have a safe life ahead. Thank you.